Good morning. Today we have the lecture of rheumatic fever and overview by Dr. Amr Gawaly, Assistant Professor of Internal Medicine. Introduction. Rheumatic fever is an inflammatory disease following infection with group A streptococci. As all of you know, that rheumatic fever is a disease characterized by inflammation which occur in the heart, sometimes in the joint, sometimes in the skin, sometimes in the brain, and so on. And these usually occur due to antibodies occurring after the infection with group A streptococci. So it affects heart, skin, joint, and central nervous system, and so it's called multi-system disease. Mostly it is due to autoimmune reaction triggered by the infectious streptococci. As you know that any infections occur, the body immune system start to uh, production of antibodies, and these antibodies must be targeted the bacteria. But in this condition, the antibodies is targeting also other tissue in the body. In etiology, we don't have a specific etiology till now, but it is still a theory. The first theory is allergic theory, means that there is a cross sensitivity between antigen of the streptococci and the cardiac tissue. So the immune system production of antibodies against cardiac tissue, he is starting to produce antibodies against the bacteria, but due to that the antigenicity of the bacteria and the antigenicity of the streptococci is the same, so it target also the cardiac tissue. So rheumatic fever occur in 2 to 3 weeks after infection with streptococci. This is very important because this is the time that the body is making these antibodies, not from the start of the disease of the infection or sore throat. So until production of and anti-streptolysin titer is high at this time. After 2 to 3 weeks, the anti-streptolysin start to be high. The predisposing factor, usually this is occur between age 5 to 15 years. It is rare below the age of 4 years or more than 25 years. Low socioeconomic status, patient who is living in crowded places, in bad ventilation, and so on. Overcrowding, like in the schools sometime, like in the factory, and so on. In developing countries, rheumatic fever it is still the most common cause of acquired heart disease, and this is very important because it is a burden for the health system. Clinical picture. The most recent classification is done by Jones, called the revised Jones criteria. We have a major criteria and minor criteria. The major criteria is carditis, arthritis, subcutaneous nodule, chorea, and the erythema marginatum. And the minor criteria is arthralgia, previous rheumatic fever, very high ESR, very high CRP, total leukocytic count also is high, and fever. Arthritis. What is the characteristic of arthritis in rheumatic fever? First, big joint with asymmetrical involvement. It taking hip joint, it taking knee joint, it taking ankle, it taking shoulder, and so on. With asymmetrical involvement mean that not both joint affected at the same time, not both knee, not both shoulder, and so on. Each joint affected for about 1 week. This is very important. Each joint affected for 1 week and then resolve it completely. Course of arthritis is about 6 weeks. The joints are swollen, red and tender. It is arthritis, means inflammation, so it's swollen and red and tender. Fleeting, very important character for the arthritis, as the inflammation is in one joint recover and the another joint become affected. Good response to salicylate. This is very characteristic for the arthritis. When you are giving steroid, the patient is resolved rapidly and responding very well. Again, the most characteristic features is taking a joint for 1 week and making it bleeding, so infection in one joint and recover and the other joint is affected with very good response to salicylate. Carditis affect mainly in the children. So the most common manifestation in the adult is arthritis, and the most common manifestation in the children is the carditis. Myocarditis means that the muscle itself of the heart is affected or inflamed by this disease. So this patient will have tachycardia and having arrhythmia. It means abnormalities in the heart rate. For example, extrasystole, muffling of the heart sound, what's called tic-tac rhythm. Because of the muscles is inflamed, so the normal sound of the heart is lub-dub, lub-dub. This sound is changed to what's called tic-tac rhythm, tic-tac rhythm. Heart failure with dilatation of the heart may result from severe myocarditis. If the muscle is inflamed by severe type, the heart may be dilated and the patient going on to heart failure. Pericarditis means the inflammation of the pericardium. It is the layer around the heart. Pericardia, it making what's called pericardial rub. It is the present indicate the severity. Pericardial rub occurs due to friction between the two layers of the pericardium, and it's present to get that the severity of the disease is high. It's usually dry, but effusion is rare. Usually dry, so the friction will making the sound, and but affection is rare. But effusion is rare. Sorry. Carditis. Also, the third type is endocarditis, and the endocarditis means it affects mitral, aortic, but tricuspid and the pulmonary valve are rarely affected. Why mitral and aortic? Because the pressure of the heart here is very high. The pressure of the blood here is very high, so it can carry the bacteria and making bacteria to catch or to attach the valve is so easy. Caricomb murmur, this is the murmur which occur in the infective in the rheumatic fever due to edema of the valve, the transient diastolic murmur on the mitral area which present during rheumatic activity to swollen mitral valve. It making what's called mitral stenosis due to swollen mitral cusp, making the sound called caricomb murmur. Mitral valvitis, inflammation of the mitral valve, fulminant rheumatic fever may lead to mitral incompetence and aortic incompetence. Sometimes, when the inflammation is severe, it making the valve to be inflamed by a severe degree, leading to necrosis and destruction of the valve and leading to incompetence. Rheumatic chorea or called St. Vitus dance. St. Vitus dance, it is like the dance of the snake when the music is playing. Dance of the snake when the music is playing. May manifest late after the initial infection and it is self-limiting after about 6 months. It occurs more common in the female. Okay, after 6 months of the rheumatic inflammation or the infection by streptococci. So, because this a large period to occur the disease, sometimes it's missed. So you must taking a very good history from the patient. Some subcutaneous nodules, it is associated with severe carditis and usually occur over patella. The patella is present in front of the knee. Scalp spinous process, it is in the nape in the back of the head, vertebra in the vertebral column, extensor tendon of the hand and the feet, extensor tendon of the hand and the feet. What is the character of this nodule? It is a small pea size, firm, not tender, not adherent to the skin. The character is very important. A small, firm, not tender, and not adherent to the skin. Erythema marginatum occur in 20 percentage of the case, it is a rounded macules. It is a rounded macule, reddish or pink with central bar. So it is like a circle. In the periphery, it is reddish or pink, and in the center, it is pale. Affect the trunk and the proximal extremities. Trunk means that the area of the abdomen in the front and in the back, and the proximal extremities mean the thigh and the upper limb. Not painful or itchy, and this is very important. So it is not an allergy or infection and so on. It appears for hours and disappear, then recur. It is usually doesn't affect the face. Investigation. There is, and this is very important statement, there is no specific laboratory test to indicate that the presence of rheumatic fever, because the antibodies will not form it except after 2 to 3 weeks. But the manifestation of inflammation will present and have blood picture, total glycocytic count will increase, ESR will increase, CRP will increase, and streptolysin titer is high. Normally it is 0 to 150 TODS unit. If it is more than 25 in adult or more than 30, 250 in adult and 333 in children, is a positive test. Very high titer or rising titer is diagnostic. It indicates recent streptococcal infection. Also, the thoracic swab for streptococci may be positive. X-ray may be showing the manifestation, cardiomegaly, BVC's myocarditis, BVC's pulmonary venous congestion. Echo will show the valve lesion and ventricular dysfunction. ECG, first and second degree heart block will be seen. Heart block occur mostly due to inflammation of the myocardium. Treatment in these patients: general measurement, rest in bed, diet, increase carbohydrate and decrease salt to avoid heavy meal. All of this is for resting of the heart. Prophylaxis of rheumatic fever, primary prevention, proper hygiene, avoiding overcrowding, good nutrition, and prevent streptococcal throat infection. Secondary prevention: the patient who catching infection must taking long-acting penicillin 1.2 million units per every 2 weeks, or oral penicillin 25 milligram per 12 hour, or erythromycin 25% to 50 milligram per 12 hour till the age of 25 years or 4-5 years after the last attack in adult. Recurrence are most common when the cardiac lesion is present, and if so, prophylaxis may be required for life. So we are giving this prophylaxis till the age of 25 years. The only exception is presence of lesion in the heart. Tertiary prevention, prevention of infective endocarditis, and this is the most common and most serious complication occurring after rheumatic activity. Penicillin. What is the rule to eliminate any residual streptococcal infection? Methylpenicillin oral 250 to 500 milligram every 6 hours for 1 week, or benzazine penicillin 1.2 million unit IM, or ampicillin or amoxicillin 500 milligram every 6 hours for 1 week. The second treatment is salicylate, and this is very important drugs for arthritis. The dose is 5 to 6 gram per day oral, divided into 6 doses. This is very high dose, very high dose. Can be affect the stomach and making a gastric ulcer. So it will be relieve symptoms of arthritis rapidly within 24 hours, but have many side effects. It should be continued until ESR has fallen and then gradually tailed off to avoid rebound arthritis. Side effects, as you see: bleeding tendency, GIT irritations, bronchospasm, nephrotoxicity. So we have a large number of side effects. The third option is the steroid indication in the severe carditis if the salicylate is not effective in the severe arthritis or it's not tolerated. The dose we are giving prednisolone 1 to 2 milligram per kg per day for about 4 weeks. Treatment of heart failure in case of rheumatic fever, myocarditis, total diet, diuretics, and steroid for myocarditis. Digitalis is better to avoid the use of used with caution as it may lead to arrhythmia and heart block. Dopamine, dobutamine, vasodilator can be used. All these elements can be supportive for the heart, making support for the heart, making the condition to be controlled and the function of the heart to be restored to avoid the complication of heart failure. Thank you.